The topic is Trichomonas, Tricomoniasis. Trichomonas is a sexually transmitted infection caused by a parasite, Trichomonas Vaginalis. Anyone who is sexually active can get the infection. It affects women more than men. People with Trichomonas often do not have symptoms. If the person does not get treated, it increases the chances of acquiring other sexually transmitted infections. It is transmitted through sexual activity. It spreads through the penis or vagina. It can also spread from one person's vagina to another person's vagina. The person can get the infection through the vulva, vagina, cervix, or urethra. Also reach the prostate. It's rare to have Trichomonas in other parts of the body, such as the mouth, hands, or anus. Anyone who has Trichomonas can spread it, even if the person has no symptoms. About 70% of people with Trichomonas have no symptoms. In some people, the signs and symptoms may show up days or weeks later. Symptoms include vaginal fluid that smells bad and is greenish or yellowish, genital itching, burning, redness, soreness, pain when the person pees or has sex, they need to pee more often, bleeding after sex. For a male, the person may notice irritation, itching, a thin white discharge, pain when the person pees or has sex, the need to pee more often. 30% of people with the infection will develop symptoms. The only way of knowing if the person has Trichomonas is by getting tested. A urine or a swab is needed. It is important to test for other sexually transmitted infections. The treatment is antibiotic, usually metronidazole or tinidazole. These cure the infection. It is important to discuss the medication benefits, side effects, interactions, and risks with the provider. About 20% of people will get Trichomonas again within 3 months. The sex partner should be tested and treated, even if the person has no symptoms. Avoid sexual activity for 7 to 10 days, and the person might need to be tested again after treatment. If not treated, the infection can lead to other health complications. If the person has HIV infection, an infection with Trichomonas can increase the transmission of HIV to other people. If the person is pregnant, an infection with Trichomonas can lead to give birth earlier than expected. The baby may have low birth weight, and the baby can also acquire it through the birth canal. Trichomonas can be prevented by avoiding sexual activity, using condoms, avoid douching, avoid multiple sexual partners, and discuss sexual history with sexual partners. I hope this topic was helpful. Thank you.